Let's talk about why it's okay to search for answers outside of the establishment. Hi, my name is Jeffrey Butts, and I'm a doctor of dental surgery. And this channel is all about health and wellness for you to be healthy and wealthy. Today, I am talking about a doctor. He's not a colleague because he's not a dentist. He's not a doctor of dental surgery. He's not an MD. He is a doctor, but he's a chiropractor doctor. Now, he's on the internet, and I've seen him for years on the internet giving what I could only consider to be really great advice. I've tried some of his concoctions that he'd say, make this, make that, and they work. So I just want to make sure that you guys know about him. His name is Dr. Alan Mandell, and he is a caring person. That's how I could best describe him. And basically, he talked about plaque. Now I'm thinking, hey buddy, excuse me, sir, doctor, you're in my area. Excuse me, this is my area. But then as I was looking at him, I was like, oh, please continue. So, let's watch.
Our oral health, our teeth are so important when it comes to taking care of it the right way. And unfortunately, with the foods that we eat today, the sugars, the sodas, the starchy foods, we can develop this sticky plaque that starts to form onto our teeth. And if the plaque is not removed, it hardens into tartar. And this sticky film that we call plaque is bacteria. And this bacteria sits on our teeth and it forms acids. And these acids eventually start to erode our teeth, our enamel, that causes cavities. But the problem with this can eventually eat away bone. It can affect your gums where it starts to recede. And without proper oral hygiene, our teeth are going to rot and they're eventually going to come out of our mouth. And if you take your tongue right now and start moving it around in the front of your teeth or behind your teeth, lower and upper, you may feel this gritty substance. That's called plaque. The problem with this bacteria is that this leads to halitosis, bad breath. And if you notice that your gums are red, swollen, or tender, and they bleed after brushing, then that's what we call gum disease, all stemming initially from that plaque. And plaque and tartar is what leads to our cavities, gingivitis, and periodontal gum disease, severe gum infections that we call periodontitis, tooth decay and loss, as well as the tooth infections, that's an abscessed tooth. And yes, that's why our dentist tells us to brush regularly a couple times a day, to remove that plaque, to prevent that tartar, and again, to preserve your teeth so they can stay healthy.
So, all of that is great, except for, yes, you do have to floss. You have to floss. You cannot just brush your teeth. So, in this video, he's actually talking about baking soda, adding a little water to baking soda, which has got sodium bicarbonate in it, which helps break up the bacteria and the plaque bundles. It's amazing, okay? This is how you can brush your teeth. It's really good. Baking soda is excellent. Baking soda, I had to do it, is excellent for brushing your teeth. Of course, you could use toothpaste, have a little abrasive. You could use Act toothpaste. You could use all types of different brands, Dr. Tom's toothpaste. Yes, you do have to brush your teeth, but oh my goodness, you must floss. Flossing is your #1 defense against bacteria and mouth disease, gum disease, cavities, all of that. #1, floss first and then brush. Not that Dr. Mandell doesn't know about it, I'm sure he does know about it, but just floss first and then brush. So the doctor was doing great, but he didn't take it all the way. I'm here to help you take it all the way. Let's go all the way. Okay, so here we go.
Now everyone has heard about baking soda. Yes, this is sodium bicarbonate 100%, and we use this as an antacid. But this can be used for many things within our house. Now who would think of taking some plain baking soda with some water, making a paste, putting it on our toothbrush, and brushing our teeth?
Actually, Back in the day, somebody thought about mixing that with a little bit of cocaine, cooking it up just a little bit and making crack rocks with it. It was very, very productive, but okay, let's keep going.
Well, this will definitely remove that plaque and prevent that tartar. And putting that baking soda mixed with water leads to the release of free radicals, which help break up plaque on the teeth and surface stains. Not only is baking soda effective in removing that plaque, it will help neutralize those acids that helps kill bacteria.
All true. All true. Thank you, Dr. Mandell. Let's keep going.
And if you notice about all those toothpastes worldwide, so many of them today have baking soda in it. But by having a little baking soda at home, using it straight up, mixing with water, brushing nice and lightly like you normally would brush, and leaving it on your teeth for 10 to 15 minutes will do remarkable things to help dissolve that plaque and prevent that tartar from occurring within your teeth and gums.
Now leaving it on your teeth for 10 minutes, that's a commitment, y'all. That is a commitment. And again, you still have to floss. And of course, you should still see a dental professional to make sure that you're seeing what you can't see or seen what you can't see. And that you're getting your teeth cleaned properly by someone else, because you can't clean your teeth as well as a professional can clean your teeth.
So baking soda will reduce the acidity and plaque that leads to eroded enamel of our teeth, as well as increases our risk of tooth decay. It helps regulate your mouth's pH by neutralizing the acid. And it has the ability to help whiten your teeth. And it has antibacterial properties to reduce the occurrence or accumulation of bacteria in your mouth that causes that decay or periodontal disease. And if you suffer from mouth sores or ulcers, baking soda can help speed up the healing. And so be aware of the foods that you're eating, those packaged, refined, processed foods, those sugars.
Being careful about what you're eating is always your number one defense for yourself. I mean, you're not going to put diesel fuel in your unleaded car. That's why I always say know what your blood type is, so that you can put in the right fuel for yourself, for your body. And all of these things actually help fight disease, because your immunity from within will help fight disease. You actually manually taking out hordes of bacteria using flossing and brushing, that will help fight disease. All of these things are important for your oral health.
Those excessive flours just eventually turn into plaque if you don't take care of it. And eat those foods in the whole state, those foods that have not been refined and processed, those foods that have fiber. So I hope this video serves you well. Please share it with your friends and family. And remember, take care of your oral health.
Absolutely take care of your oral health. Take care of your total health. But while you're taking care of your total health, your oral health is just going to fall right in there, okay? So that's Dr. Mandell. I have some other amazing doctors that I'd like to introduce you to. But for now, that's Dr. Mandell. Yes, he's speaking the truth. I concur. If you have any comments, please leave them in the comment section below. Please like and subscribe, and we'll talk about it later.